Hospitalist is actually somebody who, instead of going to an office, they work specifically in the hospital setting. So for instance, if your doctor needs to admit you to the hospital, it would be somebody like myself or one of my partners that coordinates and takes care of you while you're in the hospital setting, so that we can be here 24 hours a day and provide the care that you need, so that also your primary care doctor can still provide the care to other patients in the office setting. What excites me most every day as far as coming to work is the idea that I'm able to approach healthcare in two different aspects. I still work as a clinician where I see patients in the hospital setting, so I get to see the day-to-day changes of what they're in the hospital for and actually provide a benefit for them to feel good and well enough to get out of the hospital and return to their normal activities. And then the second part of my job is actually the responsibility of working more as an administrator for the hospitalist division. I'm able to identify where there may be what we call process gaps, where there are situations where we didn't do such a good job in providing the care or efficient care. Healthcare has changed actually in many ways, most of which is, I think, on the forefront is because of healthcare reform. I think there's a lot of things that have gone into trying to understand how reimbursement will work for hospitals, outpatient clinics, offices, services that in the past patients relied quite a bit on just through their either Medicaid, Medicare, as well as private insurance. And from a patient perspective, I think it's a matter of understanding what the responsibilities are of their insurance providers, as well as what is the individual's responsibility. I think what's changed specifically is how do we provide quality, safe care, and at the same time make sure that it's affordable and also it's financially viable for systems like Spectrum and others in communities this size to stay in existence and still be able to provide that coverage. The role for Spectrum Health Medical Group is actually one that is becoming much more defined as we grow very quickly. We started out just last year with just over 70 providers. Currently we're over 500 providers, and it's a multi-specialty approach. And the role is really to help the system, specifically the hospital, figure out how we can do better with taking care of patients that transition into a hospital as well as back out of the hospital. And additional roles are to determine how do we do it best so patients can do well in their own environment, their home. Because when they get admitted to a hospital, we're taking them out of what is their everyday expected reality to something that is very uncomfortable. They're in a situation they don't want to be in, and we need to figure out how we can coordinate the care through all of these specialists. One role is to actually create systems like electronic medical records that can be shared, whether you're going to see your primary care doctor, going to see your cardiologist, or unfortunately if you have to be admitted to the hospital, so that we can make sure that a lot of duplicate work is not being done, and also so that we have a good knowledge of what somebody's medical history is, so that we can hopefully give good quality and expedited care, based on what the need is at the time.